Dr. Farah, why is February important as far as concentrating on Heart Month?
February is known to be the official heart month for the United States. It's a very important month for all of us, particularly me. I'm a heart doctor. The reason it is important is because heart disease is the #1 killer for both men and women here in the United States. And so it's a month that we use to raise awareness, to talk about, public awareness and educating our general public as well as healthcare professionals to really pay attention and what we can do to minimize the risks that are out there.
Heart disease encompasses what? Do you think most people know?
It's a very broad term, heart disease. It could be anything related to the heart. And I actually don't know that most people know what it means. Heart disease is a wide spectrum of things. It could mean heart attack all the way to arrhythmia, and in the middle it could be heart failure, endocarditis, which is infection of the heart, congenital heart disease. There's even heart disease in pregnant women, something called peripartum cardiomyopathy that young women can have. It's unique to women. Then there's broken heart syndrome that people can have when they're going through emotional trauma. So there's a wide range of things that the word or the two words heart disease encompass.
Now, you mentioned broken heart syndrome. What is that? We've heard that before, that this is a very real thing.
It's a very real thing, yes. So broken heart syndrome typically occurs in people who go through an excessive amount of emotional trauma. It is more common among women, typically seen after a bad breakup, like a strong relationship ending, a marriage ending, like a divorce, or a loss of a loved one, like a loss of a spouse, a death. All of those things can cause broken heart syndrome. So what is it? It is a form of heart failure. The heart is a pump, and its main job is to squeeze blood out of the heart to the rest of the body. That's how we survive. And broken heart syndrome, heart failure, means that pump is not pumping efficiently enough anymore. So that muscle itself weakens and the pump is not able to squeeze as much blood as it typically does. And that can cause several symptoms. People can have shortness of breath, chest pain. Sometimes people come into the hospital in the emergency department feeling like they're actually having a heart attack. And without looking inside, we really do treat it as a heart attack initially. We take them, we rush them into the cath lab and go take a look what's happening. So it's a very real thing.
With heart attacks being mentioned, wanted to know, how do we actually know somebody's having a heart attack? What are the things that we should keep a close eye on? Is there an acronym we can remember, or what are some of those action items?
Heart attack, the main things people need to remember are the classic symptoms. The most common symptoms are usually chest pain. They'll have crushing chest pain. Often people tell us that I feel like an elephant is sitting on my chest, because that's literally what it feels like for many. Shortness of breath, profuse sweating. Some people will have no chest pain and they can have just really bad nausea, vomiting, and just feels like an indigestion, like a really bad episode of indigestion. If it is something that is a really bad episode of indigestion and they will take over-the-counter medications that won't go away, but they're having profuse sweating and stuff with that, it is an indication that they may be having a heart attack. In fact, my father had a heart attack several years ago and he didn't have any chest pain, and he just had GI symptoms. And I was luckily visiting home. I was actually in training at that time. I was a cardiology fellow. I was visiting home that time. Lucky for him that I was home, because he did not think it was a heart attack and he actually didn't want to go to the hospital. I had to force him. And I was hoping I was wrong, because he kept telling me that, no, this is you're just overreacting because you're a heart doctor. I told him that I hope I'm wrong, but you got to give me an EKG and then I'll leave you alone. So we took him to a standalone ER, and sure enough, it was a heart attack, a massive heart attack. And so we had to rush him to a big hospital at that point, and he's okay. He's okay. He's doing okay.
That's great news to find out. And of course, it also stresses the fact that if you don't happen to have a medical professional such as yourself living in the house or visiting at the house, the importance of learning CPR. How important is it? How has CPR changed over the years?
Every year, there are some updates. So as healthcare professionals, we are required to stay up to date on CPR, and we recertify every 2 years. So the updates are pretty simple. Usually it has to do with medications for the ACLS part. ACLS is advanced cardiac care training. So why is CPR important? I think it's very important. I think anybody can get trained for it, and people should, because it is absolutely life-saving. So what does CPR do? When somebody's having a cardiac arrest, and that's one of the fears with heart attack. When people have heart attack, they can go into cardiac arrest and they can actually collapse and lose their pulse and not breathe anymore. And if there is someone at home who knows how to do CPR, they can actually save that life, that loved one's life. CPR involves several steps. It's basically the basic is providing compressions in the chest to make sure that the heart is perfusing, meaning heart is able to still pump blood out, so that we are maintaining the circulatory system of the body and keeping the brain intact. Because one of the biggest issues with collapse and cardiac arrest is that the blood flow stops because the heart has stopped, and it can stop the blood flow from going to the brain, and it can cause brain damage. So even if that person is to survive the cardiac arrest, by the time EMS comes and brings them back, they can have major brain damage if they are to survive. And CPR, so for that reason, starting CPR early is very key. And that's why when family members know how to do CPR, it's very beneficial for not just saving the life, but saving that person from sustaining brain damage.
My last question to you is just curious, with a lot of people staying at home during the pandemic, a lot of people haven't been maybe as active as usual or getting their regular checkups. How can we stay on top of our heart health by going to see a doctor? What types of checkups should we make sure that we're having?
Very good question and very important question. You're absolutely right. During the pandemic, we have seen many people who are lagging behind in terms of continuing with their regular care, seeing their regular physicians. So yearly checkup is very important with your primary care physician, because that's when you do your routine labs to check your cholesterol level, diabetes level, high blood pressure. So those are the three key risk factors for heart disease: diabetes, high blood pressure, and cholesterol level. They need to be routinely checked. If you have pre-existing heart conditions, like you've had a heart attack before, if you had a blockage and you have a stent or had an open heart surgery, any heart condition really, you need to maintain that relationship with your cardiologist and make sure to receive the care that you need to prevent any further damage down the road. I will say one other thing, even for those who don't have pre-existing heart conditions and just the COVID by itself, people who have had COVID, I don't know if you know, but there was a large scale study done on COVID related to heart, how it's affecting the heart. And it just came out actually last week. 11 million people were studied here in the United States. It's a Veteran Affairs study. And it showed that across the board, COVID-19, people who are infected with COVID-19, even those who are asymptomatic or had very little symptoms due to COVID, across the board had could have been affected for their cardiovascular health. There were 20 different cardiac conditions that were studied, and we saw an increase in all of them. So we've known throughout the pandemic, we've been seeing people who've been coming into the hospital and clinic after COVID with cardiac symptoms. We've known that it is affecting the heart, and now we have evidence with this study that it is. So people should be really diligent in terms of keeping track of their risk factors and following through with their cardiologists.
This is National Heart Month. It's also Preventing Strokes Month. How are heart disease and strokes connected?
They're very connected, actually. So I'll explain it with heart attack first. So a heart attack happens when there's plaque rupture in one of our coronary arteries. What that means is basically blood flow is abruptly stopped at the place where the heart attack is taking place. And when blood flow is stopped, so the heart muscle is not getting any nutrition, oxygen, as a result of lack of blood supply. So time is life. That's what we say when it comes to heart, because if blood flow is not going in a timely manner, that part of the muscle of the heart will die. and it'll scar over time, and that can lead to serious things like cardiac arrest, death. But even if the person has survived the heart attack, they can have further things down the road like arrhythmia, heart failure, complications related to heart failure. Very similar concept when it comes to a stroke. Stroke is a very similar thing, except it's happening in the brain. It's in the blood vessel. There are two types of stroke. One is called ischemic stroke, which usually happens as a result of a narrowed blood vessel in the neck or in the brain, or it could be because you have some kind of an arrhythmia in the heart, for instance, atrial fibrillation, that causes blood clots to form in the heart. And heart is a pump, so when it's pumping the blood, that clot will travel into the brain and block up the blood flow and cause an ischemic stroke. So very similar concept to heart attack. That's one type of stroke. The second type of stroke is a hemorrhagic stroke. That typically happens as a result of hypertension, which is high blood pressure. The most common reason for having hemorrhagic stroke is high blood pressure, where the blood vessel actually ruptures in the brain and it causes bleeding to happen in the brain. And that's actually a very dangerous thing. It can be very life-threatening, both of them.